Hello everybody, Nurse Scott here. How are you? You know, you are more than just your body, and we healthcare providers know that. So why do some LGBTQ people feel the need to hide their sexual and gender identity from their primary providers? Well, I know it's because we've come out to people and been outed to people and they've turned on us. It's self-preservation. Today, for vlog number whatever, I'd like to discuss why LGBTQ people like me, I'm gay, should consider being open and honest with their primary providers, their doctors, physicians, and nurse practitioners. As I said, people are not just a bunch of organs in a skin container, and modern medicine doesn't treat people like that anymore. There was a time when doctors just treated diseases, and we nurses and everyone else just helped the body get better. But healthcare is supposed to be, at least today, is supposed to be holistic, meaning about the whole person. And your sexuality and gender and your intimate relationships, your chosen family, all of that are part of who you are. So it might scare you a little, but let's talk about why it's important to be out to your doctor, your nurse practitioner, your PA, and how you might handle some awkward situations. First, just to say these two things out loud. It's always your right not to disclose personal information about yourself, even with your healthcare team. And second, I'll be speaking from the point of view of a gay man. I'm well aware that lesbian women, bisexual people, and transgender people have different issues that a gay man wouldn't understand. And if I say something that's inaccurate or insensitive, please educate me in the comments down below. Seriously, I would love to learn from you as much as you learn from me. So it's important that your provider know a lot about you, your past medical history, your surgical history, your allergies, what type of work you do, who the people in your family are, who you have sex with and how often, what you eat, if you exercise, if you smoke, drink, or do drugs. And the more they know about you, the more personalized and relevant care they can provide, such as getting the tests that you need and not running tests that you don't need. Being alert to the different risk factors that LGBTQ people have, including, unfortunately, substance abuse and depression. And your provider may be able to refer you to an LGBTQ-friendly specialist if you ever have need for a specialist. Now, hopefully you can find a provider, a primary care provider who's comfortable with all kinds of people and treats you respectfully and is attentive. Ideally one that's really queer friendly. But you may not find the perfect provider. So if you can find one that's generally attentive and respectful, you might consider helping them help you, and in the process maybe help them take better care of queer patients in the future by pointing out things or outright teaching them about certain things. Really, we all learn from our patients every day. I love it when patients are generous to share some of what they know with me. Of course, it's not your responsibility to train a doctor in queerness, but like I said, you might look at it as helping other LGBTQ patients. So here's some examples of how this works in the real world. One time I used the terms top and bottom with my doctor, and I had to explain it. And I'll never forget it. She said, "So that's what that is." She said, "I've heard other patients say it, but I've never understood exactly what it meant." So she was smarter going forward, right? A friend of mine saw a doctor when he was in Texas who didn't know what PrEP was. And he was a little surprised at that and promptly educated him on that. By the way, if you don't know, PrEP stands for pre-exposure prophylaxis. It's a pill you take to prevent getting HIV. Other little lessons might be if your provider doesn't use your preferred pronouns, you can not only correct them, but explain why it's important to respect people's preferences. If your gynecologist orders a pregnancy test on you, you can explain that, you know, lesbians don't often have unexpected pregnancies. Just so you know, there may be other reasons to run that test, but it could be a teachable moment, perhaps, for both of you. And it might improve your patient-doctor relationship. You know, we all deserve providers that are respectful, but healthcare providers are human too, and sometimes they slip up. So I would encourage you to try not to get too offended, but rather try to be kind if something is said that is offensive or insensitive, if it doesn't come from a place of bigotry or malice. If it's just ignorance or carelessness, just stay cool and correct the person. If it's discrimination or abuse, do not stand for it. If you feel you need to, get up, get dressed, and walk out. And you can make a report about the abuse. Doctors, PAs, and nurse practitioners each have their own state board that can take disciplinary action if necessary. If you're in a hospital and something happens, ask for the nursing supervisor or the nurse manager, or even the vice president or administrator on duty if you need to. In a future video, I'll explain in depth how to complain and go up the chain of command in a hospital. Well, that was your primary provider, but what about the ER? I would say go ahead and be honest with them too. They need to give you personalized care too. I can't guarantee every ER doc, PA, NP, or nurse is 100% gay friendly, but they see patients from all walks of life. And nearly all of the ones that I've met in the last 30 years have really been open-minded. So if you're going to come out to your provider, how do you do it? What do you say? Well, there's always the tried and true, I'm gay, and just work it in wherever you feel the need. Or I'm lesbian, or I'm bi, or I'm trans. You can get it over with as soon as the appointment starts. You can start out by saying, "Oh, nice to meet you, doctor. I have to admit I'm a little nervous about seeing a new doctor. I'm gay and I've had some bad experiences in the past." And then let the doctor show you if they're an ally or not, or if they're gay themselves. When asked certain questions, answer truthfully. So if you're a gay guy and you're asked, "Are you sexually active?" you can say, not just yes, but yes, with my boyfriend. Now, usually the question that comes after that is, have your sexual partners been men, women, or both? So if you don't volunteer it in that question, you'll be asked right away. It used to be a kind of a coming out opportunity when they would ask, "So are you married?" And this used to be one of my pet peeves, maybe because I'm single. It's like they just assumed that everybody could marry the person they fell in love with. And so I felt like saying, "Are you married?" No, and even if I had met the love of my life, it wouldn't be legal for me to marry him. So even though that question hit a nerve, I don't think that was exactly the right way to respond. A doctor's visit really isn't the right time for political activism. So I could have just said no, or no, but that I wish I could, and let it go. Now, of course, we have marriage equality. Before any of this, you can ask the office before you even make the appointment. Just call and ask if they have many gay, lesbian, bi, trans patients in their practice. And you'll either get, "Oh, sure," or "Not that I know of." And you can also ask, "Do you think Dr. So-and-so would be comfortable having a gay man as a patient?" And see what they say. And of course, phrase it for your own situation. Would they be comfortable with a bisexual patient or a lesbian patient, or have they ever had a trans patient, a trans person as a patient? And even before that, you can ask friends for a recommendation if they know of a queer-friendly doctor. So at this point, I want to have just a little soapbox moment and talk about I guess how I think the healthcare system could do better by trans people. Whenever you go to the doctor or the ER or even an MRI, they sit you down with a pen and a clipboard to fill out a patient information page. And inevitably you come up on the sex box. Check 1, sex, male, female. Now, I've heard trans people say that a trans woman is a woman and a trans man is a man, and that's true. They don't want their womanhood or manhood diminished just because they were born into a body that didn't happen to match. But I think the implication sometimes when they say that is that they should be checking the box that corresponds to their gender. It's who they are. So, if a trans woman checks female on the form, she is 100% correct socially. But this is a medical form, and you may not realize that it's asking for biological information. So stay with me here. Don't comment just yet. I get that it would be hard, after fighting to be the gender you are, a woman, say, to then check male on a medical form. But I think the distinction between sex and gender is important, especially in healthcare. If you're a trans woman, you have the right to present yourself as a woman and have people treat you as a woman. You are a woman, but you're a woman who has some male organs. That doesn't diminish your womanhood, but you deserve health care that doesn't ignore any of your body parts. And your doctor should never set you up for a pelvic exam. If you're a trans guy, you have the right to present yourself as a man and to have people treat you as a man. You are a man, but you're a man who has some female organs, unless you've had them removed. This doesn't diminish your manhood, but you deserve health care that doesn't ignore any of your body parts. And the doctor should never expect you to turn your head and cough. So I don't want trans women to check the male box or trans men to check the female box. But we healthcare providers need to ask the right questions and for patients to understand how to answer. As a side note, they used to ask if a male patient was gay or bisexual to evaluate the risk for HIV. And of course, HIV doesn't care about your identity, only about your behavior. You can be gay and celibate, or you can be straight but fool around with guys sometimes. So now we ask what we really want to know: if a person is sexually active and if their partners are men, women, or both. We got this one right. Now, how about fixing those sex checkboxes? We should keep the little box that asks about sex, and patients should check off the sex than they were assigned at birth or determined by DNA, however you want to look at it. Maybe relabel it sex/gender assigned at birth. And then the options would be male and female, and maybe even intersex or unclear. There are babies born with ambiguous genitalia. It's not clear if they're male or female, and they require further testing before the doctor can put down and assign a sex. And then we should have a separate little box for gender and label it current gender identity. Current because people are free to identify different ways at different times in their lives. And the options would be male, female, binary, and other. Those two boxes then would give us the biological information and the psychosocial information that would help us to start to create an accurate picture, an accurate holistic picture of who the patient is and treat them appropriately. And in both senses of the word, to treat them appropriately and to treat them appropriately. On all the hospital computer systems that I've ever used, I've never seen anything like this, but the time has come. End of rant. So in conclusion, we all are, not only complex biological organisms, but complex psychosocial beings. Healthcare providers now treat people as whole people, not just diseases. And to do this, they really need to know as much as they can about patients as possible, and not just about sex and gender. They need to know if you can afford your prescription. They need to know if you're raising children or caring for an elderly parent. They need to know your risk factors for different diseases, biological, behavioral, environmental risk factors. And we need patients to be open and honest, as open and honest as they can with us, even the LGBTQ ones. It's the job of the doctor, PA, or nurse practitioner to educate themselves about diverse populations. And I believe it's the job of patients to help them as much as they feel comfortable. I hope you found this discussion enlightening. If so, please like this video and consider subscribing to the channel and clicking the bell so you'll be notified when new videos are available. Thanks for joining me today, and I'll see you next time.